So we assessed our recorded patient with bicep tendinopathy. So once we have come up with our assessment of what we think this is, now we can begin to try to manage the injury. So in the beginning of this phase, we want to, of course, ask the athlete what they want to get out of this necessary rehabilitation program, what goals they may have in mind, so that way we can make a plan that's specific and unique to that individual. So once we've come up with what we think the injury may be, once we've asked the athlete or the patient, what their goals are, and we've come up with a plan, we can start implementing that plan. So we can start with pain-free range of motion, whether that's active range of motion, passive range of motion, or dealing with manual therapy or any type of modalities to deal with the pain, the swelling. Once we've done that, we can progress to our strengthening program, and then so forth and so forth, as long as the athlete is progressing and we haven't made the injury worse, or there's no new injuries or new signs and symptoms that would lead to, we're making the injury worse instead of making the injury better. So pain-free range of motion, strengthening program, limit their reps or activities with practice right now. Maybe not participating in games until we've gotten that pain-free range of motion and strength back, and then we will we will alter the participation and the rehabilitation program as the athlete progresses. And if the athlete does get worse, then of course we need to reevaluate, and then if it's not something we can manage, we can refer out. But as long as it's something we can manage, then we can adjust. So bicep tendinopathy, and then we'll begin with pain-free range of motion, and then progressing to a strengthening program.